Welcome to Let's Talk Brock.
Hi, everyone, and welcome to this week's episode of the Let's Talk Brock podcast. I'm your host, Wendy, and today we're here with Caleb, who graduated from our Kinesiology program in 2017. He is currently a full-time physiotherapist at Zero Gravity Physiotherapy in Welland. While he was here at Brock, he was in a club called Power to Change. He was in Med Plus for 3 years, and he was also involved in various intramurals. So thank you for joining us today, Caleb. How are you doing tonight?
I'm doing well. Thanks for having me on, Wendy.
Of course, I can't wait to learn all about you and what you're up to now. So, to get started, why don't you tell us a little bit about why you chose to study kinesiology here at Brock, and why you wanted to join Med Plus during your studies?
Sure. Brock was always the top choice for me because I'm from the Niagara region, and my older sister went to Brock as well, so it was pretty natural for me to also go to Brock. And then I chose kinesiology partly because of a love for sports in high school. And then also I really enjoyed subjects like biology. So I thought kinesiology was a good mixture of that. I was also interested in healthcare. And even in my grade 12 in high school, I was leaning towards physiotherapy. So I thought kinesiology was a good route for that. My father was a pharmacist, actually, so that was part of the reason for interest in healthcare. But I liked a degree in an eventual profession where I would be quite active, so that's kinesiology.
Yeah.
And then the Med Plus component of it was, again, an interest in healthcare. But I also felt I had a limited knowledge in just the healthcare field in general, and specifically physiotherapy, and not only what it was, but how to get into it. And I remember in grade 12 thinking that Med Plus was probably the best route to learn more and also to eventually get into one of these programs.
Nice. That sounds awesome. I'm also from around here, so I relate to that too, because I grew up here. I'm in nursing too, so I also was interested in healthcare. So that's really awesome. While we're on the topic of Med Plus, what are the top 3 things that you learned or have taken on with you in your career from Med Plus?
Yeah, so we definitely learned a lot. One thing that I definitely took away was professionalism. Just the process of going to different seminars and workshops with colleagues, but also with healthcare professionals, and having conversations with them. The expectation was always that we'd be professional, business casual dress, and also just having professional conversations. And I think that expectation of professionalism really helps with things like applications, but also down the road as a healthcare professional myself now. And then another thing that I learned a lot about and have taken with me is just a knowledge of how diverse the healthcare sector is, because of various speakers in different fields during Med Plus. And we got a lot of exposure to kind of what they did on a day-to-day basis. And so we really got to appreciate the diversity, not only between different professions, but also within professions. So one physiotherapist versus another, different doctors are quite diverse in how they might treat or what kind of settings they treat in. And then I think the other thing that was quite helpful is the amount of connections that we gained through it. So there was a lot of opportunity for volunteering, and that was encouraged. And also with the different presentations from healthcare professionals, it was always encouraged to network with them afterwards and ask questions, and even job shadow at times. And I think it was, first of all, good access to networking, but then also a good how-to network as well. And of course, that carries forward into a career and interactions down the road.
For sure. I know. I think networking is definitely very important. And also just like all the other things you mentioned, I think they're all like good things that everyone has to learn. Because even like right now I have like my clinicals where I'm at the hospital and like I feel like a lot of what you said,
Yeah,
very true. I can attest to that. And yeah, I know. I feel like I see that, Med Plus would really, really help with that.
yeah, for sure.
So, moving on, why do you think that other students who are maybe interested in physiotherapy or just like any health related career should consider Med Plus?
I think definitely if you're considering any graduate school, it gives a good framework for the process of getting in. I think if I
I,
didn't have Med Plus, I would probably have felt quite lost with the process and may have missed steps or had um, maybe
I,
gotten around to those steps, but would have regretted the way that I got there. And Med Plus really ensured that you, from the start, knew what you needed to do at what time in the process. So even with things like marks and volunteering, starting that early on, and with the entire application process, it was really helpful too. So I would say that framework that's kind of given to you is very helpful.
I,
I also think it helps you or it teaches you skills to interact well with the healthcare world. So whether that's volunteering or interactions with presenters, um, first of all, there was the opportunity, but then MedPlus also tried to, through seminars, give us the skills to be successful in those opportunities. There
I,
was a lot of connections. And I remember too, when I was actually making my applications for physiotherapy school and preparing for McMaster had interviews. And I did a ton of preparation with MedPlus staff for those interviews.
mhm.
So that was like the one-on-one help there was really, really helpful.
Yeah, I know that sounds really good because I feel like for the most part, like most kind of healthcare related jobs, like require kind of like additional schooling or just like doing a little more. And it sounds like, Med Plus really like helps you with like the guidance and like also like the practice too. Cause like I honestly didn't know that like you could get that like one-on-one kind of practice. And that's like it definitely sounds very beneficial.
Yeah, it was.
Yeah. Okay, now moving more towards, I guess, just, kinesiology in your undergrad here. What experiential learning opportunities did you have, like, all throughout your undergrad, and how did you obtain them?
Yeah, so I
I,
had a number of them, and I would say a lot of them were not directly through my program, but through other avenues. So I spent a half year physio or shadowing physiotherapists at like a local clinic, and I connected with the owner of that clinic, Jeff Aird, through a presentation that he gave in a lecture. So it was
oh, wow.
kind of a conversation afterwards.
Yeah,
Um,
no, I think it's definitely cool. Just like the way it's like, because you see them, then you can kind of follow up and be like,
yeah,
oh, like I saw you here. And so it's a good like segue.
yeah, for sure. Um, another, I did volunteer every single year. One was at with Big Brother Big Sister. Another was Brock Senior Fit. Um, and then I also did some with Niagara Children's Center as well. And so those were pretty hands-on experiences. And then one that was through the program was I did like an undergraduate thesis with one of my kinesiology professors, Craig Takuno. And basically the thesis was to program and like implement a program for a stroke patient down in the Rock Senior Pit gym. So that was pretty hands-on as well.
Yeah, no, that sounds so cool. How was like the whole process and like doing that? Just because like I don't know, I've like looked through kind of like courses I can take and I see some of them like, require like the thesis and it just like it seems really like intimidating. So like how was your experience with all that?
Yeah, it was really good. And I almost had forgotten about that experience until I was thinking
Mhm.
about what I had done. But I recall that it was fairly informal how I ended up getting it. I remember talking to my program advisor, and it was a suggestion by her. And then I just reached out to the professor probably at his office hours and discussed what opportunities would be present.
Yeah.
And I sort of already had a connection down at the Brock Senior Fit gym from volunteering there.
Hmm.
Um, yeah, and I had I had a lot of freedom with what I could do there. It did involve
Yeah.
some writing and some research as well, but it was quite self-directed and a lot of fun actually.
Yeah, no, it definitely sounds super cool. And it's like great that you like had the connections too. I feel like you had like a lot of connections and it like really helped with a lot of things. That's super cool. All right, moving on. If you could give advice to both a first year and a fourth year kinesiology student, what would that advice look like?
Yeah, so I think in first year, taking things seriously overall, specifically like marks do matter, and I knew that in my first year, but a lot of colleagues didn't.
I'm,
Um, because a lot of the programs for graduate school do take first year marks into account, even though they're not weighted heavily.
yeah, I know.
Uh,
I didn't even know that.
yeah, so it does help to try hard. I also think volunteering early on is helpful for
I'm,
exposure, but also for future applications to have a good number of hours. Um, and then another thing for first years was that I was thinking of was look at your prerequisites. If especially if you already sort of know what direction you're leaning towards, it's helpful to know. I remember I had to get a psychology for one of the physio programs, and I did that in my first year.
I'm,
And there was a couple other prerequisites that were helpful to know prior to planning your degree.
I'm,
Um, and then another, I guess this isn't a first year thing, but I went on a student exchange to England in my
oh,
third.
wow.
Yeah, I was in my third year. I would encourage doing that.
Mm-hmm.
Yeah, with the caveat that even though marks didn't show up on your Brock transcript, you actually had to submit them to graduate school still.
Oh, wow.
So
Interesting.
if you do an
Yeah.
exchange, still try to get good marks there.
Yeah. That sounds so cool. I like love to, like hearing about people's exchange stories and it's like it's so awesome. How do you think like your exchange kind of I guess influenced like your life, just you, everything overall?
Yeah,
I'm
it probably made me desire to travel more. Um, I think it made me more adventurous, probably, and
Mhm.
uh,
I'm I'm
yeah, opened up my mind to different cultures in a way that I probably
I'm
wouldn't have had if I
I'm
had.
I'm
Yeah, uh, it was maybe professionally not specifically helpful, but just in terms of overall personal.
yeah, I feel like life-wise, like yeah, it's a good experience. And
And
like who wouldn't want to
looking back,
travel?
yeah, looking back, it probably wouldn't happen now. So
Yeah, no, it's definitely like harder later on.
that I did it, I did.
For sure. Yeah, well, after all that, how did you get into your first physiotherapy job?
Yeah,
I'm,
so that was actually through a at University of Toronto physiotherapy program. There was another student from Niagara a year above me, and he had a connection at a physio clinic out in Welland. And I believe I shadowed the owner of the clinic. Um,
I'm,
I think in March, and then I had my last placement was in
I'm,
August of that same year, and so through that shadowing, I was able to set up a placement with them as my last physiotherapy placement, and was hired out of the placement. So I went from placement as a student to working there.
yeah. I know I hear like so much of those, and it's like it's so like cool and convenient how it's like you start off there, then you end up working there. And is that
Yeah,
where you like work now, since you mentioned Welland?
yeah, yeah. So it's the
Yeah.
same clinic. I've been there for 4 years now. Um,
Nice.
yeah, and it's great.
Yeah, that's so awesome. That like that sounds so like inspirational in itself. Just like you were a student, you did your placements there, and it's like 4 years later, you're still there. That's awesome.
Yeah, it
What do
does
you think?
well because
Yeah,
it is sort of like a job interview, both for the owner and also the you to know if you're a good fit there.
yeah, for sure. And it's like I think having that experience, like doing your placement there is also like I don't know, good experience. And I don't know, you get like a sneak preview of like what it would be like to work there. And then there you were, you ended up working there.
Yeah, exactly. It's your free
Yeah,
trial.
I know. Yeah, that's a good way to look at it. Is there anything that you wish you knew before becoming a physiotherapist?
Um, Probably the broad scope of it. So I did not know a lot about physiotherapy at all before I got into Brock, and also then before I got into the physio program, I thought I knew more, but there were certain things I didn't know at all. Like I had no idea that physios did anything with the cardiorespiratory system, and that was our entire first unit.
Wow.
um, yeah, so I think just the broadness of the scope,
Mhm.
and
Yeah, for sure.
now
I
I
know,
know.
I totally agree. Like even with nursing, I feel like I didn't know like about all like the possible options because there's like a lot of things you could do like in the hospital, like even outside of the hospital, just like yeah, no, I think one thing about healthcare, it's like there's a lot of different options and there's a lot about it.
Yeah, yeah,
Yeah.
you never have to be bored. You can always switch
Yeah, for
places in your
sure.
schedule, right?
For sure. What do you think is the most rewarding part of being a physiotherapist?
So I think it's very rewarding that you can bring hope to people when they're at a low point in their life. Often your patients will be going through something that's a hardship, whether it's an injury or pain or they're recovering from a surgery and they're at a low point relatively. And part of your role is to help them see the light at the end of the tunnel.
Hmm.
And it's very rewarding, like especially in an initial assessment when you assess them and hopefully you rule out anything too worrisome and you explain to them that there's hope and you start to see like a glimmer of hope in their eye.
Yeah.
And then you
No, that's
actually get to be the
mhm.
therapist that helps them achieve that. It's very,
Yeah, I know that sounds so rewarding. And it's like, I think it would be fun to kind of see kind of the whole like progress, transformation of them, like at the beginning till the end. And then, I don't know, it's very different because even in the
yeah,
hospital, sometimes, like when I meet people, they're like sad, upset, hopeless, just not great. And then, like, you get to watch them like be better. And then it's like, it's kind of cool. You're like a part of the process and it's like now they're like doing better, which is like always good too.
yeah, exactly. You see them through their low point to
Yeah.
hopefully a success, which is
Yeah.
kind of fun.
I know, I love that too. All right, so the last thing we're going to discuss today is we've talked about the rewarding parts, and now we're going to get into maybe some of the more challenging parts of being a physiotherapist. So the question is, what is the most challenging part of being a physiotherapist, and how do you kind of counter that and deal with it?
Yeah, so it's more or less the opposite when people don't really get better. And I think how I would counter that is you're continuing as you treat someone to reassess them. So hopefully you're not treating them for months and all of a sudden realizing they're not getting better. Um, and referring on when necessary, and then also recognizing that recovery can be very complex. So not blaming yourself or blaming the patient, but realizing that there's a lot of factors involved. I think another thing that's tough is when patients don't believe you if you're trying to deliver information to them. Uh,
Yeah.
and I would manage that by not taking it personally, being very gracious with them. And I think too, a lot of people, if they believe you enough to start doing the things that you suggest, and the results that happen, then they will start to believe you. So,
Yes,
but
I think
those
that is so
tough
true.
if they're not
Mhm.
really trusting what you're saying.
For sure. I know, I see it all the time in the hospital too. And I don't know, it's so different. What like happens if they listen and they like believe you. It's just,
Can't
that's
help
so,
you.
I know, that is so funny. Well, thank you so much for answering all of the questions and, for your time. I think I definitely learned a lot from you as like someone also aspiring to be in healthcare. So yeah, thank you very much for your time and telling us all about your Brock experience. with kinesiology and med plus, as well as your career now. It is so awesome and great to hear about, all the things you're up to now and how, your placement ended up being your job now. Like, I still think that was super cool and awesome. So thank you.
Thanks for hosting me.
Of course. Well, have a good day.
Thank you.
Thanks for joining us. If you have any questions, you can contact us at broccu.ca/discover/contact.